I am Dr. Johnnie Wright Jr. and I'm glad to be the newest member of the women's health team here at UNC Health Southeastern. As a female pelvic medicine and reconstructive surgeon or a urogynecologist, I focus on female pelvic floor disorders. Basically, any type of prolapse or incontinence, those are the two most common pelvic floor disorders that I deal with. And that prolapse could be a relaxation or a dropping of the vagina, the rectum, the bladder itself, and or incontinence, which could just be incontinence of stool and or the bladder of urine. And on rare occasions, there's artificial communication between those organs, between the vagina and the bladder, the vagina and the rectum, or some other portion of the female genital tract. And those are called fistulas that I employ mainly conservative therapies for, but definitely surgical procedures that can be completed abdominally, vaginally, or laparoscopically, and hopefully pretty soon robotically here in our system. Urogynecologist should be about quality of life, okay? It's a pretty happy field. The reason why I went into female pelvic medicine and reconstructive surgery is because it's not usually doom and gloom or me having to give patients negative news about cancer. If a patient can empty her bowels and her bladder and have a meaningful sexual relationship, then frankly there really isn't anything that I could do to make that better. And so I approach my care and counsel my patients for their options for management through that lens. That is usually never a good time to have surgery, but there's an ideal time for them to have surgery, and that's when her symptoms are worse, or I tell them when you're having more bad days than good days, then hey, we can talk about options. I welcome the opportunity to see a patient as a self-referral, or she can work with her primary care provider. They could call the Women's Health Clinic at the Oaks directly at 910-738-2454, or they could reach out to the main hospital, UNC Health Southeastern, and they can route them appropriately to get to the right place to come in.